Welcome back, everybody. Good morning to you in this morning's For Your Family segment. Baseball season officially starts this week for a lot of area little leagues and softball leagues. But for parents of young athletes, there are some new concerns that you should be aware of right now. Doctors are seeing more overuse syndrome in children. And joining us this morning is Dr. Greg Nicholson, a shoulder and elbow expert with Midwest Orthopaedics at Rush. Good morning, Dr. Nicholson.
Good morning.
Nice to have you here.
Thank you for having me.
Well, you know, I have a 10-year-old who's starting baseball. I know a lot of families are very excited. It's springtime. They're ready to get out there. But as a doctor, you're saying you're seeing a lot more young athletes being injured, especially with a throwing arm. What's going on? Well,
it is springtime and baseball starts. Being the pitcher is a very elite type of position. You don't really want to lose that position, and there's a lot of throwing. It's spring, it's March, so the concentration of what's happened, I think, is that we do this over and over again. So repetitive stress injury can occur in these kids because their skeleton is so young.
And you're calling it is called overuse syndrome. Exactly what is that, and how do we spot signs of that as parents?
Well, overuse syndrome is really an injury that is a submaximal force. It wouldn't cause an injury one time, but it doesn't allow the young skeleton to adjust or heal. So over time, those signs and symptoms are a little bit more subtle, and then the child complains of some pain, or the parent notices that they're dropping their arm, or they're running differently, or they're swinging the bat differently. So it's a more vague onset.
Now, you also have some tips for parents on how to protect them from overuse syndrome, starting with knowing the pitch count.
Correct. In 2008, the Little League of America instituted a pitch count, and then days of rest between depending on how many pitches you threw, then you had to rest. We've seen a 50% drop in injuries since that institution of the pitch count. So pitch count's very important.
You also suggest watch for psychological burnout in your 10-year-old. How do you spot that?
Well, you know, your kid should be happy. They should be playing, right? Now, if they become a little bit more sullen, or that you ask them, are they hurt, and they say no, it's a sign.
Okay, and you also said, and I've heard this a lot, don't play year-round, but a lot of kids today are focusing year-round.
Well, we say play, right, but it's gotten more competitive. We've all watched ESPN. All youth overhand athletes, throwers, volleyball players, swimmers, whatever it may be, should take a break. They shouldn't play that sport all year round.
And no weight training on game day. Why is that?
Well, again, it's a young skeleton. They need to be flexible and strong. And for them, I think it's something that can damage them. They should strengthen in between those athletic days.
I see. Now, what is the treatment for overuse syndrome?
Well, I think you have to recognize it first, and then number two, you have to back the athlete out of whatever activity they're doing to get into it. If you were a runner, you would stop running. If you were a thrower, you would stop throwing. But I think the athlete can still participate in baseball. They just shouldn't pitch or catch. They could designate hit, or they could play first base.
Now, what do you say to parents, which I'm sure you've heard this before, parents who say, you know what, I know it's easy to say my kid shouldn't play year-round, but they need to do that to stay competitive starting at such a young age right now.
You're right. And in today's world, I think we've educated the kids and we've educated the parents, and we parents are also the coaches. So we need to educate the coaches, too, that, hey, we need to take a break on these select teams, these travel teams, and these all-year-round sport issues.
I like the other thing that the doctor says, when in doubt, keep them out. When in doubt, if they can play or not, keep them out for a while.
If the athlete's hurt, they're not going to play well, and they're just at higher risk for injury. So a day or two, they can recover very quickly.
Very good information. Thank you so much for coming in this morning.
It's been a pleasure. Thank you.
Dr. Nicholson. Again, some just important information to keep in mind as Little League season gets started right now. It's springtime, it's fun, and it should remain fun. If you'd like more information, we will have a link to Midwest Orthopaedics on our website at abc7chicago.com. We'll be back with weather and traffic right after this.